This is a mess.
And the more we learn, the worse it is. All right, please stick around, because there was a new report from the White House Council of Economic Advisors out today that says between 2010 and 2013, those years, healthcare costs rose at the lowest rate in a 3-year period on record. And the White House is saying this because of Obamacare. CNBC's chief Washington correspondent John Harwood joins us now with the details of this debate.
Well, everybody knows the Obama administration is being hammered for all the difficulties with Obamacare and its rollout, from the website to the dislocation of some people who are losing their plans. So the White House decided today to try to push back by playing on one of the favorable trends in health care, and that is the slowdown nationally in health care costs. Now, that's been going on for several years. There's a lot of debate over whether it's about the slowdown in economic activity or actual changes in the healthcare system. But Jason Furman, the chair of the Council of Economic Advisors, put out a report today in which he took at least partial credit for reforms in the Affordable Care Act driving down those costs. Now, here's some of the headline numbers about cost growth slowdown. First of all, for the last 3 years, healthcare spending per capita has risen only at 1.3% a year beyond inflation. That's the slowest 3-year period in the last 50 years and is something that has persisted even after the economy has recovered. Healthcare price inflation, that is the cost of healthcare services, is now going up on a year-to-year basis, according to this report, only by 1% year over year. And the benefits of that flow not just to American corporations and individuals, but also to the government, because according to the Congressional Budget Office, the spending on Medicare and Medicaid by 2020 will be 10% less if this cost growth slowdown persists. Now, everybody is waiting to see whether, in fact, if the economy grows more robustly, it's going to wipe out some of these effects. But for now, the administration points to things like changes in reimbursement rates, hospital readmission penalties to make sure that providers are providing care more efficiently, accountable care organizations, all sorts of reforms that potentially could slow health care costs over the long run. And that's something the administration wants to point to. We'll see how long it lasts.
All right. Many thanks, John Howard. Appreciate it. Now we're back with our panel, Congressman Brad Wenstrup, Bob Leshevsky, and Ovik Roy. Gentlemen, I want to get your quick take on what John Harwood just reported. There is a difference of opinion about definitions here. The Washington Post, the Pinocchio page guy, Glenn Kessler, he said national health care expenditures have been growing at about 4%, just under 4% for the same time period. So there may be a definitional issue. But the question before the House, both of these numbers are slowdown numbers. The question before the House, and I'll start with you, Congressman, can Obamacare take credit for either the 1.5% number or the 4% number? Both are slowdowns. Can he take credit?
Well, I've been practicing until last December, and I saw a lot of changes in how we were doing things. One, you're always striving to be more efficient with your patients. And the other thing is patients started to have more skin in the game. That's one of the things I definitely saw, is deductibles went up and co-pays, et cetera. And with hard economic times, there were fewer people coming to the doctor, and they gave things more time to get better on their own before they came to the doctor. But what I saw firsthand is people, while they had some part to play in the decision-making process, would say, do I need that MRI today, doctor? Can we wait a week and try some of these other things and see how I'm doing and maybe save? Because I'm going to have to put out a lot of money for this.
Right.
And when people are more invested, then you see it become more efficient.
Ovik, some people say the slowdown in health care costs, whichever number you use, Jason Furman's number or the Washington Post number, is a function of the recession, of fewer people who have insurance, and fewer people going to the doctor, Ovik, that it really was more economic grounded. What's your take on that relative to the White House, who says it's Obamacare that's causing it?
I've covered this topic extensively on my Forbes blog, and I can tell you, Larry, it's a good thing that there's been some slowdown in health cost growth, but it's economic and statistical hucksterism to credit Obamacare for this. There are two issues that you've alluded to. The first is the recession, which has slowed down health care spending across the developed world, not just the United States, but also in Europe, Japan, everywhere. The second factor is what the congressman alluded to. There's been a dramatic increase in the use of high-deductible insurance and health savings savings accounts, particularly among employer-based plans. Those are the two biggest drivers of the slowdown. Obamacare hasn't gone into effect yet. The vast majority of Obamacare goes into effect in 2014. These things like ACOs and some of the other things that John Harwood was mentioning, they're tiny, tiny tinkerings around the edges. They have no significant impact on health spending.
All right, Bob Leshevsky, I'll give you the last word on this debate. Obamacare, recession, what's responsible for the slowdown in health costs?
The Congressman and Avik just gave you all the reasons. I can't add to those. This is a shameful public relations release. There isn't a single healthcare economist out there, liberal or conservative, that isn't laughing tonight. Obamacare is a health insurance, quote-unquote, reform bill. Most of the stuff in Obamacare designed to deal with costs, like the Cadillac tax or accountable care organizations. Accountable care organizations are a pilot program, for Pete's sakes. This is, if Glenn Kessler doesn't give this one 10 Pinocchios, I'm going to lose my respect for him.
I've been working off Kessler's page. I admire him very much on the Pinocchios. He hasn't made a decision yet. He's not willing to say yes, but he's not willing to say no. So
Glenn, do 10 or I've lost my respect for you.
Well, give him a call or an email. All right, now, please, Congressman Wenstrup and Bob and Obik, hang around. We've got some more work to do. I want to address what looks like a new round of insurance policy cancellations, a new round. And we could be talking as much as 100 million cancellations of employer-based policies. So don't forget, free market capitalism is the best path to prosperity. So far, I ain't hearing any real economic freedom in the healthcare sector. I'm Kudlow. We'll be right back. But first, please listen to this litany of warnings about Obamacare website from yesterday's hearings on Capitol Hill.
Would any of you advise an American citizen to use this website as the security issues now exist? Yes or no?
No, sir, not this time.
Same answer.
Same answer.
Yeah, I wouldn't yet.
So it's a unanimous no, don't use the website because of the security risks.
I would say that the security would have to be studied a lot more carefully before I would agree to that.